Declaring a public health emergency does a couple of things. One, it raises the profile so that we get more attention paid to it and people are more aware of it, which is a good thing. And two, it allows me to draft an order which allows medical health officers to collect information that they otherwise wouldn't be able to collect. So we're actually in the purpose of refining that order now, so that we'll be looking for basic information on person, place, where did it happen, the person's age, identity, were they connected with previous health services or not, when did this happen, where did it happen, so that we can try and focus our outreach and our prevention more targeted.
So the Drug Overdose and Alert Partnership has been carrying on for a number of years. So we've been really working together for 5, 6 years. And it includes members from enforcement, from health, from the coroner's office, from ambulance, and from people who use drugs. So we get together and look at information that's available, and it's through that and through the coordinated efforts that we identified this worrying increase in overdoses and overdose deaths. And we share the data together and look at what we can do and interventions that may make a difference.
I think what needs to be changed in Canada, two things. We need affordable, a continuum of care where you detox, and then right now if you want to go to a program, you have to detox, and then you have to wait to get into a program. The programs are 6 weeks long, and you're looking at $30,000. And I don't know many parents who can afford that or afford it multiple times, right? You want to save your child, you're going to do whatever you can do. But if it was subsidized, as we would treat any illness, they could go from detox right into treatment, and then in working like in a lifestyle change. Something that took maybe a year. From what I've heard, it takes about a year to come off a drug like fentanyl. And as number two is the decriminalization of drugs. And that there would be safe drugs available, that there wouldn't be tainted heroin, that there's supervised injection sites, somebody's there. We need these, we have the one Insight and Dr. Peters Center. But there's a real problem in Kamloops right now. There's a problem in Surrey. And I think we need to have them, maybe not so much in the burbs, but in centers outside of Vancouver.
You know, there's 12,000 physicians in British Columbia, but over the last 20 years, there has been a real message change when it comes to prescribing opioids. 20 years ago, we were being told that we were under-prescribing opioids, which were the appropriate treatment for so many pain conditions. And now in 2016, I think we know very clearly that there is limited evidence of effectiveness of opioids, particularly for non-cancer pain. We've all been given the wrong story over the last couple of decades, I think. We've all been given the impression that these pills have a higher level of effectiveness than they do, and also that they're less dangerous than they really are. And I think now both physicians and patients need to know that there are better treatments that are less dangerous, and that if your chronic pain condition is not related to an end-of-life diagnosis, it is not worth the risk in most cases to take opioids.